Welcome to Understanding Your Blood Counts During Chemotherapy, an educational program for patients with cancer and their caregivers. All cells in the body use DNA as a blueprint to divide into new cells that replace old, dying cells as part of the body's normal wear and tear process. Damage to DNA could lead to rapid and out-of-control growth of cells. This is the hallmark of cancer. Many cancers can be treated with chemotherapy medicines that kill these fast-growing cancer cells. Unfortunately, chemotherapy also attacks fast-growing healthy cells, including those that form hair follicles, the lining of the mouth and stomach, reproductive cells, and blood cells. The temporary loss of these normal cells causes many of the side effects associated with chemotherapy. According to a recent survey of doctors, one of the most important side effects of chemotherapy is the impact on blood cells. To help you better understand the impact of chemotherapy on your overall health, in the program you'll learn what blood cells do and how they are made to help better understand the impact of treatment on your overall health. In addition to plasma, which is mostly water, salt, and proteins, the blood pumping through your body contains three main cellular components. They are red blood cells, white blood cells, and platelets. Each of these cells has a unique and important function. Red blood cells carry oxygen from the lungs to the body's muscles and organs and remove carbon dioxide, a waste product, away from tissues. Oxygen is critical to the health of your tissues and organs. Certain white blood cells fight bacteria that can cause infection by absorbing and destroying bacteria to help protect against infection. Platelets help stop bleeding by forming a clot and start the process of wound healing. Blood cells are continually renewed in a process that requires multiple growth factors made by the body. Your doctor will check your blood counts to make sure they are within a safe range. All blood cells and platelets are made in the bone marrow from unique cells called stem cells. The body's own growth factors direct these stem cells to divide and form the various kinds of blood cells. One growth factor, made in the kidneys, stimulates stem cells in the bone marrow to become oxygen-carrying red blood cells. Other growth factors in the body direct stem cells to make infection-fighting white blood cells, including neutrophils, the most common type of white blood cell. Stem cells also give rise to the cells that make platelets. This process is supported by the body's own growth factors. Certain types of chemotherapy can interfere with the natural process of blood cell production, lowering the numbers of red cells, white cells, and platelets. Low blood cell counts increase your risk of anemia, acquiring an infection, or having a bleeding episode. Talk to your healthcare professional about monitoring your blood cell counts during chemotherapy.